pregnancy just after miscarriage. There is hope for all. Realize that each and every pregnancy has its private plus and minus, which ought to be accepted gratefully. You should really assemble your courage to have yet another attempt. Construct a robust romantic relationship with your husband or wife and make the conclusion with each other. The motivating portion is that some physicians are suggesting a pregnancy following waiting for a period of time of 6 months after a miscarriage. Some medical practitioners are even suggesting an earlier time, assuming there is no bodily problem and the couple is not really affected by the loss, and discover no explanation to wait any lengthier. Statistics exhibit that a minimal of around 85% of adult females who experienced miscarriage will have a productive pregnancy soon after doing the judgment to try once again following a single loss. Though about 75% of adult females who skilled 2 to 3 losses are prosperous to get pregnant as shortly as the consider yet again. The conclusion is that the probability to get pregnant immediately after a miscarriage is nevertheless fantastic, which depends on the steadiness and courage of the couple. If you are in the appropriate hands of a specialist, then you have a greater probability to make a faster decision. Finding pregnant following a miscarriage can be a pretty tricky determination for partners. It is not uncomplicated to offer with the sorrow and grief of miscarriage. A great deal more making an attempt to conceive yet again. It may possibly seem extremely hard and undesirable for some couples, though other folks are additional interested on acquiring pregnant right away just after the incident. In most scenarios, partners have a tendency to go back again and forth, so it is essential to get your time to determine. The greatest time to get pregnant following a miscarriage depends on many components. Although it could consider a even though to recover equally emotionally and physically following a miscarriage, other variables have to be viewed as such as your age, connection state, household issues, well-being and other things. Your physician can help you determine, primarily when it arrives to finding out when you are prepared physically to conceive yet again. On top of that, your doctor can also recommend books and other assets to aid you make a conclusion. Make confident that you speak with your spouse about how you feel and attempting to conceive all over again. Keep in thoughts that when encountering miscarriage, there is a huge range of feelings, this sort of as depression, anger, frustration, nervousness, sadness and blame. As a result, you should be capable to deal with these in advance of wanting to conceive. It is also organic for these emotions to increase months after the miscarriage occurs, which tends to make pregnancy look like too considerably of a threat for most couples at this stage. One more variable to think about ahead of determining to get pregnant soon after miscarriage is the physical things. The miscarriage you have seasoned will probably affect your readiness physically. Your medical professional must be capable to support you make a choice. You can also sustain your wellness by following a specific workout and diet regimen. On top of that, you should try to steer clear of your damaging lifestyle elements, these kinds of as drinking and smoking.